Hello guys, welcome to the 12th part of our important questions for RRB. So we are further going to discuss some important questions which are relevant for the examination of railways. Now only few days are left for the examination, so you should practice more and more questions. So let's begin with this 12th part. So the first question here says the KUF value of high flux dialyzer is dash ml per r per mm of Sg. So you have to tell the value KUF value of a high flux dialyzer. So option A is less than 5, option B is 10 to 20, option C is more than 20, option D is 5 to 10. So the right answer is it is 10 to 20. It is more than 20. High flux dialyzers have a higher interpretation coefficient KUF, usually more than 20 ml per r per mm Hg, allowing better fluid and middle molecular clearance. So whenever they ask about high flux dialyzer, you have always to mark above 20 KUF value. Moving ahead to the next question, it says which one of the following antihypertensive drug can cause hyperkalemia in hemodialysis patients? So here we have to tell which antihypertensive drug can cause hyperkalemia. So option A is angiotensin receptor blocker, option B is vasodilator, option C is alpha receptor blockers, and option D is loop diuretics. So the right answer is option A. The ARBs or the angiotensin receptor blockers decreases aldosterone secretions, reducing potassium excretion, which result in risk of hyperkalemia, especially in dialysis patients. So ARBs, they decrease the aldosterone level, and because of that, potassium excretion also get affected. Moving to the next question, it says the following are congenital disease of kidney except. So we have to find the exception. So option A is PKD, polycystic kidney disease, option B is nail patella syndrome, option C is Alport syndrome, option D is vasculitis. So the right answer will be option D, vasculitis, because PKD, nail patella syndrome and Alport syndromes are congenital hereditary disorders. This is from the pathology part. However, the vasculitis is an acquired inflammatory disease. So this one is the odd one out here. Moving to the next question, it says identify the stage of chronic kidney disease when the GFR rate is 58 ml per minute. So this is a very easy question. If you know the stages of the CKD, you will be able to easily mark the answer. So since we know that in stage 1 the GFR is generally above 90, in stage 2 it is 60 to 89, in stage 3 it is 30 to 59. So this value lies in this certain range, so answer will be 3. The third stage is further divided into A and B. Sometimes they ask question regarding them also, so make sure you also know the values of them. Moving to the next question, it says the following are high risk factors for UTI except. We have to tell the exceptional option here. So option A is undwelling Foley's catheter, option B is diabetes, option C is female gender, option D is male gender. So UTI is very uncommon. Usually complicated UTI is only found in male gender. So the right answer here will be male gender. However, undwelling Foley catheter is very cause of the UTI. Same is with the diabetes, and female gender is most prone to UTI. So the right answer will be male gender. Moving to the next question here, it says what is the correct angle at which to cannulate an AV fistula? So the angle for cannulation is very important. So option A is 60 to 90 degree, option B is 35 to 45 degree, option C is 25 to 35 degree, option D is 10 to 15 degree. So we have to tell the right answer, and the right answer is 25 to 35 degree here. AV fistula cannulation is ideally performed at 25 to 35 angle, preventing infiltration and vessel injury. Moving to the seventh question here, it says the needle sites on an AV fistula are rotated. Now, why we do this rotation? So, option A is to prevent stenosis, option B is to prevent pseudoaneurysm, option C is to prevent Steele syndrome, option D is to prevent infiltration. So, if we puncture same site again and again, what will happen? A pseudoaneurysm, like the skin will become very thin at that particular area, and it will bulge out, making a aneurysm, pseudoaneurysm, false aneurysm. So here the skin is very weak and it can further lead to damage of the fistula. So that's why, to prevent pseudoaneurysm, we rotate the needle site. Now, rotating needle site technique is also known as rope ladder technique, and this prevents wall trauma, avoid pseudoaneurysm formation. Moving to the next question, it says the following drugs are direct thrombin inhibitors. So these are DTI used in hemodialysis, except, so we have to tell the one which is not a DTI. Option A is fondaparinux, option B is meloxicam, option C is hirudin, option D is argavetone. So as we know here, the fondaparinux is not does not fall in the category of DTI, direct thrombin inhibitor, while meloxicam, hirudin and argatroban, they all are part of DTI anticoagulants, whereas the fondaparinux, it inhibits factor 10A and is not a direct thrombin inhibitor. Moving to the next question, it says the renal artery after entering the renal sinus divides into dash artery. So option A is arcuate, option B is interlobar, option C is segmental, option D is intralobular. So we have to find. So if you know the hierarchy of the renal artery, you will be easily able to answer this. So the right answer will be segmental artery. So renal artery branching order is like renal artery, then it goes to segmental, then interlobar, then arcuate, and then intralobular artery. So here our answer will be in segmental. Moving to the last question of this part, it says clearance of leptin is increased with which of the following modality of dialysis? Now, if you know about leptin is a middle weight molecule. So now we know it's a middle molecule. So the best modality to remove will it be low flux hemodialysis? No. Will it be low efficiency hemodialysis? No. Middle flux might be, but not generally. High flux dialysis is the most relevant option here. So here leptin is a middle molecular weight substance removed more effectively with high flux membrane. So here we discussed these 10 questions which have been previously asked in the RRB 2019 examination. In next part we will further discuss some important questions. So make sure you solve these questions yourself, and make sure you like and subscribe the channel. Thank you. Have a nice day.